The doctor who treats your mesothelioma may be the single most important factor in the outcome of your treatment. Mesothelioma is extremely rare, and most oncologists see only a handful of cases in their entire careers, or none at all. You need a specialist who sees mesothelioma regularly, who understands the nuances of treatment, who knows about clinical trials, and who has the experience to navigate complex decisions. Today, I want to tell you exactly how to find the best mesothelioma doctor and why it matters so much. I'm Terri Oppenheimer, and I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But finding the right doctor could change the trajectory of your disease. Let's start with why mesothelioma requires specialized expertise. Mesothelioma is extremely rare. Only about 3,000 cases are diagnosed in the United States each year. Most community oncologists might see 1 or 2 cases in a decade, and they might not see any at all. They simply don't have the experience base to provide you with optimal care. Mesothelioma treatment is also rapidly evolving. New immunotherapy combinations, novel chemotherapy regimens, genetic testing that guides treatment decisions, and clinical trials of cutting-edge therapies. A doctor who doesn't specialize in mesothelioma can't possibly stay current on all these developments while also managing their general oncology practice. Treatment decisions in mesothelioma are nuanced. Should a patient have surgery? Which surgery? Should they start with chemotherapy or immunotherapy? Are they a candidate for a clinical trial? These questions require expertise that comes only with seeing many, many mesothelioma cases and understanding the literature deeply. So, how do you find a mesothelioma specialist? Start by identifying cancer centers with dedicated mesothelioma programs. These are typically major academic medical centers or NCI-designated comprehensive cancer centers. Examples include Brigham and Women's Hospital in Boston, MD Anderson Cancer Center in Houston, Memorial Sloan Kettering in New York, University of Chicago Medicine, UCLA, UCSF, and many others. These centers don't just have oncologists who treat mesothelioma occasionally. They have multidisciplinary mesothelioma programs with teams of specialists who work together, thoracic surgeons who specialize in mesothelioma surgery, medical oncologists who specialize in thoracic malignancies, including mesothelioma, radiation oncologists experienced with mesothelioma, and pathologists who specialize in diagnosing mesothelioma. They have radiologists who interpret mesothelioma imaging and support staff, including nurses, social workers, and care coordinators who understand mesothelioma. Now, I'm going to take a quick break here to ask you a favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, getting back to what I was saying, the multidisciplinary approach that these major medical centers use is critical. Cases are discussed at tumor boards where surgeons, oncologists, radiologists, and pathologists review imaging, pathology, and clinical information together and recommend a coordinated treatment plan for each patient. This collaborative approach produces better outcomes than individual doctors making decisions in isolation. Look for doctors who participate in mesothelioma clinical trials. Active involvement in research is a marker of both expertise and commitment to advancing the field. It also means your doctor has access to cutting-edge treatments through clinical trials that might not be available elsewhere. Check credentials and experience. How many mesothelioma patients does this doctor treat per year? Doctors at specialized centers might see 50, 100, or more mesothelioma patients annually, where a community oncologist might see 2. That volume matters enormously for expertise. Is the doctor board certified in medical oncology, thoracic surgery, or the relevant specialty? Do they publish research on mesothelioma in peer-reviewed journals? Do they speak at mesothelioma conferences? These are all indicators of recognized expertise. For surgical candidates specifically, if you're considering cytoreductive surgery with HIPEC for peritoneal mesothelioma or a pleurectomy decortication for pleural mesothelioma, you need a surgeon with extensive experience in these specific procedures. Ask how many of these surgeries the surgeon performs per year. For complex surgeries like cytoreductive surgery with HIPEC, you want a surgeon who does dozens per year, not a few. Geographic considerations matter, but don't let distance prevent you from seeing a specialist. Many patients travel to specialized centers for initial consultation, treatment planning, and major interventions like surgery, then receive follow-up care closer to home. Most specialized centers are accustomed to coordinating care with local oncologists. Here's how to approach the process. Get a referral from your current doctor to a mesothelioma specialist or contact specialized centers directly. Almost all of them have nurse navigators or patient coordinators who can help you schedule an appointment. Bring all your medical records, imaging studies on disk, and pathology slides to the specialist's appointment. Be prepared to ask questions about treatment options, clinical trials, expected outcomes, and coordination with local care. What questions should you ask a potential mesothelioma doctor? Start with, how many mesothelioma patients do you treat per year? What treatment approach would you recommend for my specific case and why? Am I a candidate for clinical trials? What are the potential benefits and risks of the treatment plan you're considering? And how will my care be coordinated if I need to receive some treatment locally? Also, find out what their typical follow-up protocol is and what support services are available through their center. Don't be afraid to ask for a second opinion, even from multiple specialized centers. Mesothelioma treatment is complex enough that different experts may have somewhat different approaches. Hearing multiple perspectives helps you make an informed decision. Most reputable specialists support and even recommend that patients get second opinions. There are definitely some red flags to watch out for, and these include doctors who claim that they can cure your mesothelioma without evidence, doctors pushing unproven alternative treatments over standard care, doctors who discourage getting a second opinion, doctors at facilities that claim specialization but see very few patients. A doctor who isn't aware of recent advances like immunotherapy combinations or genetic testing, these are all red flags. The relationship between you and your doctor matters. You need someone you can communicate with, who listens to your concerns, who explains things in terms you understand, and who involves you in the decision-making. Expertise is essential, but so is a doctor-patient relationship built on trust and communication. Some patients do benefit from having a local oncologist in addition to a mesothelioma specialist. The specialist at a major center provides expertise and treatment planning, while a local oncologist can provide you with day-to-day care, help you manage side effects, and handle urgent issues. This shared care model works well, especially for patients who live far from a specialized center. Insurance and financial considerations are real. Make sure that the specialists and centers you're considering are in network for your insurance if possible. If the best specialist is out of network, work with your insurance company on exceptions, or see if the center has financial counselors who can help you navigate coverage. For veterans, VA medical centers do have some mesothelioma expertise, but you can also receive care at non-VA specialized centers if you choose to do so. Work with the VA to understand your options. Finding the best doctors sometimes means being your own advocate. Don't just accept treatment from whoever you were referred to initially. Research the best centers, make appointments, ask hard questions, and choose the specialist you have the most confidence in. So how do you find the best mesothelioma doctor? Look for specialists at major cancer centers with dedicated mesothelioma programs who see many cases per year. Participate in clinical trials and research, work in multidisciplinary teams, and have deep expertise in this specific disease. Don't settle for a general oncologist when specialist expertise is available. Travel if it's necessary for an initial consultation and all major treatments. Visit mesothelioma.net to get more extensive information on specialized mesothelioma centers and doctors. You can also call us at 1-800-692-8608 to speak to one of our patient advocates, or you can use the chat feature on our website. As for me, remember to post questions below, and I'll see you next time.